the Toronto Star, I'm Saba Itazaz, and this matters. Earlier this year, as Ontario fought an overwhelming third wave of this pandemic, ICUs began filling up with an unlikely patient demographic: COVID-infected pregnant people struggling to breathe. It's well documented and well known since that pregnant people with COVID and their unborn babies are at significantly high risk, requiring hospitalization and intensive care. 6 months ago, COVID's third wave in Ontario saw more pregnant people in ICUs than both of the previous waves combined, and now we're seeing similar tragedies play out in Alberta in the province's devastating fourth wave. Babies are being delivered while pregnant patients are on ventilators. This is what led to the push and prioritization of vaccination for those who are pregnant. There is now global data proving that the vaccines have no risk for pregnant people. In fact, it could save lives. Yet, vaccine rates of pregnant people remain low in Ontario. Vaccine hesitancy is a big problem within this risk group. There are multiple reasons for that, and they're important to understand. So I got our health reporter, Megan Ogilvie, who's been reporting on this, to come in and explain why pregnant people might be vaccine hesitant, what they need to know, and why it's incredibly important that they get that shot. Hi, Megan. Thanks for joining me on the podcast.
Thanks for having me today.
So, Megan, the increased risk of COVID-19 for pregnant people is quite well known now, and you reported on its devastating impacts about 6 months ago when it got particularly bad during the third wave. But can you paint us a picture of what was going on then?
Yes, that was definitely a scary time in the pandemic. It was when COVID cases were surging and, there were hundreds of COVID patients in ICUs. And it was also the first time in the pandemic that doctors and care providers that I'm in touch with started to email and text me saying that they were seeing more and more pregnant people sick with COVID needing hospital care. It was really shocking to them. And to put it into perspective, like in the first 13 months of the pandemic, data shows there was about 13 pregnant individuals sick with COVID in ICU. But, in just those first 3 weeks of April, from my count and talking to obstetricians, there were at least 20 pregnant people sick with COVID in ICU. Like it was this huge, drastic increase. And, one conversation that I had with a prominent obstetrician at Mount Sinai Hospital in Toronto, I think will stick with me for a long time. She said, it was just so shocking to walk into an ICU and see otherwise healthy young women, people with no medical problems, be 25 weeks pregnant and intubated. Like it just doesn't happen in quote unquote normal times. And I also wanted to say that sadly, right now in Alberta ICUs, they're seeing similar or like higher numbers of pregnant patients with COVID in their fourth wave. So I think this tragedy kind of continues.
Right. And I think that's what led to a push in Ontario to vaccinate this vulnerable group, right? It wasn't a priority before that.
Yes. No, you're exactly right. So if we have to remind ourselves what it was like last April and early spring, and the vaccines were still being only rolled out to the high-risk groups, like those in LTC and healthcare workers and some Ontarians with underlying medical conditions. But in April, when medical professionals started to see more and more pregnant people come to hospital sick with COVID, that's when they started to advocate for this vulnerable group. And some medical physician groups also came out quite strongly saying it was time for Ontario to prioritize pregnant people. And in fact, they did so on April 23rd.
Mm-hmm. So do you have any of the recent data? What are the recent vaccination rates like for pregnant people? And are they enough according to health experts? Are they adequate?
Yeah, no, from reporting for the story that we published in the Star on the weekend, I did try my best to figure out what the vaccination rates are for the pregnant population. And right now, the most recent data shows about 60% of pregnant individuals in Ontario are fully vaccinated. And that's data from the week ending October 3rd. But, at the same time period, about 80% of the general population was fully vaxxed. And so, yes, doctors and health experts do want to close that gap. And that 40% of expectant mothers and pregnant people aren't protected really, really worries care providers.
Mm-hmm. And you talked about this sort of vaccine hesitancy aspect in your piece as well. There are multiple concerns that the vaccine uptake has been slow among this group since the prioritization began. Why is that? Why are so many rejecting the shot or are hesitant?
Yeah, I put that exact question to the dozen or so researchers and healthcare providers that I spoke to in reporting for my story. And one of them said, that's the $1 million question. It's what so many of them are trying to answer themselves. I tried to lay out some of the reasons in my weekend story. And, what I found, it's really complex with a lot of nuances. But I think generally it comes down to expectant mothers and other pregnant individuals wanting to make the very best decision for their unborn baby. And they want to be like 110% sure the vaccine is the right choice. A few experts I talked to said there's this culture of protection in pregnancy. We think about everything, what do you eat, the position that you sleep, can you have coffee, how much is too much exercises? And it's so ingrained to be ultra cautious while pregnant. And so I think for pregnant people, having just a statement from the government or from a physician group saying that vaccines were safe and effective wasn't going to be enough. And what I learned was that care providers say these one-on-one conversations are really important and critical to help people understand the risks and benefits.
Right. And to be fair, this study, other studies, data, and trials for pregnant people came fairly late in the process. And there were so many unknowns as well because the advice kept changing from leading health organizations. So this must have been particularly challenging for pregnant people to navigate. What are some of the anxieties and concerns they had? Because I do believe you reported about an Instagram account that's being run by a doctor in Ontario, right? And some concerns are being shared on that.
Yes, you're exactly right. And that's what I did hear from many of the pregnant people I spoke to and the care providers, that because pregnant people weren't included in the original vaccine trials, and something, I want to say that that's not new. There's a longstanding practice to include pregnant folks from vaccine and drug trials right at the beginning, back to that culture of protection in pregnancy. So when the vaccines were first being rolled out in December and January, some very prominent health organizations, including the WHO, urged caution for pregnant people until more data was available. And I think those initial statements now, almost 9 or 10 months ago, was a seed of concern or caution for a lot of pregnant people. And now as real-world vaccine data has become available, those same health organizations have walked back those initial statements of concern. I think, again, we have to remind ourselves what it was like in the pandemic 9 months ago in early 2021. There was no global unified stance on COVID vaccines and pregnancy. And I think that was really difficult for pregnant people and their families and care providers. And so Dr. Tali Bogler, with her colleagues at St. Michael's Hospital in Toronto, has since March 2020, right when the pandemic started, has an Instagram account geared to people with questions about pregnancy and parenthood in the pandemic. And they have seen questions about COVID vaccines since last spring and continuing through the summer. And so just having a place where free evidence-based advice has been helpful for the pregnant population.
We'll be right back. And like you said, open sort of forums for conversations would be helpful in building that trust. And Megan, I think you made an important distinction in your report that there is vaccine hesitancy here, but this is not really something that can be lumped together with the anti-vaxxers groups or the conversation we've been having on that front, right?
Yes, totally. Almost every expert I spoke with talked about a spectrum of vaccine hesitancy in general, or sort of ranging from those who have mild concerns to people who have acute fears. And that they also pointed out that pregnancy is really unique in some ways. Like many people who are pregnant are young and otherwise healthy and who would not normally consider themselves at risk of serious illness. And they also pointed out that many people who are unsure of the COVID vaccine in pregnancy do accept other vaccines while pregnant, like the vaccine for flu or whooping cough. So they're not, quote unquote, anti-vax. And I think that goes back to the point of why it's critical to listen to pregnant people. And there are researchers, including Dr. D'Souza and McMaster, who's trying to figure out at the grassroots level some of the questions about why pregnant folks are hesitant for this particular vaccine.
And I think you talked to Alison LaRoque in your piece, and her struggle to make this decision during her pregnancy journey is kind of an example and kind of speaks to how challenging and scary this has been. So tell me a little bit more about her.
Yeah, sure. I was really grateful for the pregnant individuals who agreed to speak with me and were so open about their concerns and fears for my story. And Alison's, I found like her pregnancy journey mirrored so many others. So she found out last February that she was pregnant with her second child, right at the same time when that second wave in Ontario was shifting into the scary third wave. She'd been paying attention to what the advice was for getting the vaccine during pregnancy and was really worried about the conflicting statements that were being put out at that time. You know, even in March and April, her own obstetrician couldn't say with confidence that getting the vaccine was the right choice. But by May, She'd read so many news reports of pregnant people getting sick and needing ICU care. So she and her partner decided it was time to get that vaccine. When I was talking to her, it was heartbreaking. She said, she cried when she got the vaccine. And at first I assumed it was because of relief, but she cried because she was still so scared. And she said that when the nurse giving her the shot told her that she was making the right decision, that in her hospital, she'd seen pregnant patients sick in the ICU, and reassured Allison that she didn't want to be one of those people. And that conversation in that moment was something that really helped Allison overcome her fears. I really felt for her. I think I have friends and family members with similar stories. And I really do think if I'd been pregnant last spring, I'd also have struggled to make a decision.
Same here. It's really tricky with the changing data, and you're thinking for yourself and your child as well. So definitely there's a lot to navigate there. So for now, to make things clear, what does the science say now about these concerns? Is there new data that can help clarify some of this confusion and help people make a decision?
Yes. Yeah. This is so important to clarify. Right now, it's universally recommended to get the COVID vaccine while pregnant. I wanted to say that many, many large studies have so far shown no safety signals with getting the COVID vaccine while pregnant. So, for example, right now that seems there's no increased risk of miscarriage, for example. At the same time, data is showing the risks that come with getting COVID while pregnant. They are higher. In all of my reporting, it was really reassuring for me to hear some of Canada's top scientists who study these things say there is no indication of any concerns with the approved COVID vaccines, and that getting vaccines while pregnant has historically been shown to be safe.
And I know it's been talked about a lot now, but I think it might be helpful to kind of reiterate in this context. And while we're talking about how important vaccines are for pregnant people, can you talk a little bit about what the increased risks of COVID-19 are for pregnant people? What kind of complications or dangers are there?
Yes, that's such a good point. With the Delta variant, it's now clear that, if you're comparing people about the same age, that those who are pregnant have a higher risk of severe disease than those who aren't pregnant. And there's more recent studies have shown that getting sick with the virus while pregnant leads to a higher risk of preterm birth. So about a 13% increased risk, or almost double the risk than the general population. And for me, that was in reporting the story, that was a really key moment for me, because we know that some babies born preterm can have long-term health complications. And so I think, data is now showing that getting the COVID vaccine while pregnant also helps protect your baby too.
Right. And are these the kinds of conversations that healthcare workers are having with patients? What are they doing to address this? You already talked about one physician who has an Instagram account to kind of address some of this.
Yes. So physicians and midwives and other care providers really have stressed to me in reporting for this story and others that one-on-one conversations with patients who are hesitant are really important. Remy, the midwife I spoke with for this story, said she's found giving hesitant folks time and space to make their decision has been really important. She stressed that it often can take more than one conversation and to not give up. She and others also said that validating concerns is really key. The concerns that pregnant folks come to them about are really genuine. They want to make the best choice for themselves and their baby. So validating that, to really listen, to not brush them off, is important. One mom I spoke to said that it meant everything to her that her physician listened to her worries and then validated her concerns and then walked her through step by step how the science of the vaccine works. Also, while pointing out that the risks of getting COVID while pregnant were really real.
And is this the sort of advice that you've gleaned from experts? Is this something that people can take to talk to their loved ones about it? If someone is pregnant and still has concerns, or if someone listening has a loved one in a similar situation, are these the kinds of conversations that are needed in person to create trust and encourage more people to take the shot?
Yes. Yeah, absolutely. I think, reporting and writing this story was really important to me because I know so many people, including close friends in my family, who struggled with this decision. So I tried to come at the story with a lot of empathy. The pandemic has been hard on all of us, but I think being pregnant during this time has been especially hard. And all the people I spoke to for this story, you're right. One of the main takeaways is how important it is to listen and to have multiple conversations, to be patient, to keep highlighting both the real benefits of the vaccines and the risks to staying unvaccinated at this time. The physician who I spoke to, who co-led the Instagram account for pregnancy, she had this really striking anecdote that I included in my story, which was there was a post from a follower who said that, they're 30 weeks pregnant and they still had questions about the vaccine. They talked about it, wondering if it was going to be dangerous. And Tally, Dr. Bogler, took this as a sign that, there's people still listening, still wanting to make the right decision, that more pressing now to address those concerns to that population, to keep listening and to keep providing the best advice.
Right. And like you said, Megan, that's one thing we've learned during this pandemic is that compassion is key if you're going to navigate this. Thank you so much for your time and for your insight, Megan. That was a great conversation.
Oh, thanks for having me. I appreciate you still highlighting this important topic.
I appreciate you highlighting it too, Megan. Stay safe. Take care.
Okay.
I was talking to the Star's health reporter, Megan Ogilvie. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mudhar, and Sean Pattington. Our music is by So-Called, Mike DeAngelis, and Sean Pattington. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.